Assalamualaikum, I'm Bushra Fees and my roll number is PP1650056. The drug I am assigned is Benznidazole. Benznidazole, it is a nitramidazole derivative that is a drug of choice for treating infections which are caused by Trypanosoma cruzi. It is an antiparasitic medication which is used in the treatment of Kigas disease. Rational uses of benznidazole are: it is an antibiotic which is used to treat parasitic infection, for example, Kigas disease, and it works by stopping the growth of certain parasite. It is highly effective in early disease and this decreases in those who have long-term infection. Benznidazole is also effective in the treatment of Trypanosoma cruzi infections, which is caused by immunosuppression, for example, in the people with AIDS. Irrational uses. Too much use of benznidazole can cause hypersensitivity reaction, for example, dermatitis with a skin eruption which can occur after 7 to 10 days of the treatment, generalized edema, fever, lymphadenopathy, joint and muscle pain. It can further cause bone marrow suppression, thrombocytopenia, agranulocytosis, and some serious effects like peripheral polyneuropathy, paresthesia, and polyneuritis. The mechanism of action of the drug is basically it binds to proteins, DNA or RNA, and results in the damage of these macromolecules. Benznidazole basically increases the death of the Trypanosoma cruzi by interacting through the interferon gamma, which is present in increased amount due to the inflammation which is caused by the damage of these macromolecules. So the DNA in the parasite is affected by the benznidazole. It undergoes extensive unpacking with overexpression of the DNA repair proteins which contribute to the mechanism of action of the drug. Alternative choices with reasons. There are no such alternative choices available. Only benznidazole is used for the treatment of Kigas disease and it can be used with combination of other drugs as well. Likewise, alternative choices, there are no alternative brands available. Only benznidazole is used for the treatment of this disease. Alternative choices and alternative brands both are not available. Available dosage forms, basically oral dosage form are available and they are preferred more than other dosage forms and they are more potent. Two dosage forms are available: benznidazole tablet 100 mg and benznidazole tablet 150 mg. Acha, what is actually Kigas disease? It is also known as American trypanosomiasis. It is a tropical parasitic disease which is caused by Trypanosoma cruzi and is spread through an insect called tritomini. Now the drug-drug interaction. The drugs which interact with the benznidazole are as follows. Basically, the drug abicavir, it may decrease the excretion rate of benznidazole and it causes high serum level in the blood. Another drug, it has been shown to decrease the rate of clearance of 5-fluorouracil. The GLP-1 receptor agonist, lixisenatide, it may slow down the absorption and the activity of the benznidazole. Now, the adverse effects. Following are the adverse effects, for example, abdominal pain, rash, weight loss, headache, nausea, neutropenia, eosinophilia, decreased appetite, hypersensitivity, skin reactions, and diarrhea. The toxicity which is caused by benznidazole, basically at clinically relevant doses, benznidazole can produce hepatotoxicity, peripheral polyneuropathy, and angioedema. Toxicity antidote. Basically, if the drug adverse reactions are more than the use of benznidazole is limited, we will check the risk to benefit ratio. If risk is more than the benefit, then we will limit the use of the benznidazole, and if further toxicity occurs, then we will lead to treatment discontinuation. Another drug, nifurtimox, is also used as second line of agent. Now we have a case study. Let's see what it says. A 53-year-old female with no significant past medical history came with complaints of fever, headache, left eye swelling 2 weeks after returning from Costa Rica. Initially, she had eye swelling, pruritus, pain. Then her fever became as high as 102.9 degrees centigrade. The patient was sent to the emergency department to be evaluated for periorbital cellulitis. She complained of left eye pain, headache, daily fever to 102 degrees centigrade, dyspnea on exertion, decrease energy, decrease appetite, and blotchy rash. So after the physical examination, the temperature was normal, like 37.1 degrees centigrade. There was periorbital edema, and after the lab test, it was revealed that the creatinine level was 0.6 mg per dl. ALT and AST were 48 and 53 respectively. Peripheral blood smear showed trypomastigotes of Trypanosoma cruzi. So the question arises, how would you approach this case and how would you manage this patient? Basically, here is a picture of the patient with this disease. So we can see the left eye is swollen and it is red all over. So now how will we manage? Soap notes. The chief complaint was left eye swelling and pain and fevers daily to 102 degrees centigrade, dyspnea on exertion, and blotchy rash. Now the subject. Age was 53 years, gender female, onset 2 days after returning from the trip. Location left eye, duration 2 weeks after returning from the trip. Characterization basically left eye swelling was there, headache, fever up to 102 degrees centigrade, dyspnea on exertion, decreased appetite, rash. They are all symptoms of Kegels disease. Temperature. Okay, the temperature was normal 37.1 degrees centigrade. ALT and AST were 48 and 53 respectively. Creatinine was 0.6 mg per dl. History, there was no significant past medical history. Now the object. The patient has no significant history but had traveled from Costa Rica before the presentation of the symptoms. Basically, before the onset of the symptoms, she had traveled from Costa Rica. Her fever was 102.9 degrees centigrade. Peripheral blood smear showed trypomastigotes of Trypanosoma cruzi. She had left eye swelling, pruritus, and pain. Now the assessment. What is our assessment? Basically, the patient's blood was tested with multi-target polymerase chain reaction PCR and it was tested positive. Enzyme linked immunosorbent assay ELSA. It was also tested positive, and indirect fluorescent antibody. It was also tested positive, which further confirmed Trypanosoma cruzi. We had its stains and further we had different tests, so it all confirmed Trypanosoma cruzi. Now what is the plan? The patient was initiated on nifurtimox or benznidazole therapy, which was the only treatment for Kegels disease, at a dose of 8 mg per kg per day up to 90 days. So benznidazole or nifurtimox therapy was initiated at a dose of 8 mg per kg up to 90 days, and if side effects like anorexia, insomnia, irritability occur, they were dissipate slowly after the completion of the therapy. Both medicines, nifurtimox and benznidazole, are reactive 100% in curing the disease if given soon after the infection at the onset of the acute phase. Peripheral smear was negative for parasite 1 week after the treatment. The PCR became negative after 2 months of the treatment. The patient continues follow-up with a primary care provider. Now, Note: basically, travelers should be educated concerning the risk for vector-borne disease transmission, including Chagas disease. Many people should be educated about these diseases. People are advised to avoid residence in poorly constructed dwellings, sleep under insecticide impregnated bed sheets, and tucks in the edges. They should also be advised to take precautions while engaging in outdoor activities. Basically, they should be careful of their surroundings, of their hygiene. They should maintain their hygienic level. All emergency rooms, travel, clinic physicians, they should be alert to the possibility of Chagas disease. They should be well known, well aware of the disease. Now the references: drug info, sys.com, sciencedirect.com, drugbank.com, academicoup.com, rxlist.com. Thank you.